Assalamualaikum, sister.
Waalaikumsalam. Yes, can I help you?
I would like to buy this medicine for my grandma. Can you help me?
Let me see. Oh, glibenclamide.
Yes.
Hamiza,
Yes.
can you take 2 strips of glibenclamide from the shelf?
Okay.
Here's the medicine.
Thank you.
Here, make sure your grandma take it once daily, 30 minutes before her meal.
Oh, okay. Thank you.
How's your grandma going well?
Inshallah. Thank you.
Have a nice day.
Hey,
Bakis, where are you from?
I came from the pharmacy. I buy some medicine for my grandma.
Oh, what kind of medicine?
Glibenclamide.
Oh, it's sulfonylurea drug.
What is that?
Okay, let me tell you.
What is sulfonylurea drug?
Oh, sulfonylurea drug is actually derived from the antibiotic. This antibiotic was created to treat typhoid fever. So the history is
Wow, this is amazing. I think by chance sulfonylurea compound can induce hypoglycemia.
Really, bro? Let me see.
Come.
Wow, great job, bro.
History of sulfonylurea. In 1942, chemist Mason Jambon and co-workers studied antibiotics for typhoid fever. However, by chance, they discovered sulfonylurea action caused severe hypoglycemia in their subjects. In 1946, study of hypoglycemia by action of sulfonamides in dog and rabbits showed that degree of hypoglycemia was dose-dependent. Between 1953 and 1954, 2 new sulfonamide derivatives were developed, carbutamide and tolbutamide, which is the first to be tested for human use throughout the world. In 1984, ATP-sensitive potassium channel was discovered in pancreatic islets. In 1995, the specific binding site for sulfonylurea subunit SUR1 on ATP-sensitive potassium channel was revealed. 3 generations of sulfonylurea drugs. In 1950s, first generation are tolbutamide, clofuramide, and talazamide. In 1984, second generations are glipizide and glibenclamide. In 1995, third generations are glimepiride.
There are 4 steps of approaches in drug discovery process. First, choosing the disease of problem, increasing numbers of diabetes mellitus type 2 patients. Second, choosing the drug target. Sulfonylurea drug blocks potassium channel of beta cell in pancreas, which trigger rise of calcium ion in cell and subsequently allows release of insulin. Third, identify the bioassay. The test should be simple, quick, and relevant. Lastly, find the lead compound. Lead compound is a compound which shows desired pharmaceutical activity, providing a step for the drug design and development process.
I have read from the conspiration book that the drug has been tested on the rats. From what I know, the biology of rat and human are different. Is it true?
Yes, it is true that biological of the animals and humans are different, and it is true that the drug was tested on the rat, but it was conducted on under the strict and safe regulation, which is
In vivo is a studies using a rat epidermal adipose tissue with or without the drugs. Insulin binding, hexose transport, and glucose metabolism were compared in the adipocytes. Sulfonylurea used as the hypoglycemic agent to control the majority of the diabetes. Other sulfonylurea exert to observe extrapancreatic hypoglycemic effect. Sulfonylurea alter the binding of insulin. It do not depend on receptor number or affinity but the concentration of telosomites. The result is plasma level returns or fall below pre-treatment. Implanting mice with low-release sulfonylurea to inhibit B-cell potassium ATP knockout mice. After a week of treatment, the mice were as glucose tolerant as adult potassium ATP knockout. Chronic glibenclamide treatment in vivo caused loss of insulin secretory capacity. In vitro is a inverse U hypothesis, which it is a studies using mice. It is to check response to enhance excitability. Hyperexcitability drive B cells to insulin secretory failure.
The conspiration book also said that the drug has been tested to the prisoners. Is it true?
Actually, the claim was wrong. We have 4 clinical trials, and these clinical trials are conducted to the people who are willing to do this, and they are not being forced, which is
Human clinical trials can be divided into different stages called phase 1, phase 2, phase 3, and phase 4.
For the phase 1 trials, they are only recruiting only a few patients between 20 and 80 that is carried out on healthy volunteer or who has disease. Normally, this trial takes several months before move to the next phase. The phase 1 trial is to ascertain safety. At this phase, the dose given is gradually increased from one group to another group until the best dose to be given is found, and approximately only 70% of drug are able to move to the next phase. Phase 1, the drug will pass to the phase 2 trials. These phase trials are often larger than phase 1, which involve about 300 until 500 individuals with disease condition, and it takes several months to 2 years to complete the phase. Conducted in order to know whether the new treatment worked well enough to test in a phase 3 trials, to identify more about the side effects and how to manage them, and lastly, to find out the best dose to be used for the patients. New drug is compared with established standard drug or with placebo. If it is shown the new treatment is good as existing treatment, it will move to the phase trial 3. There are only 33% of drugs move to the third phase.
Phase 3. It is for the comparison of new treatments with the best currently available treatment. It also involves many more patients to show the difference. Phase 3 is the most expensive, time-consuming, and difficult trials to design or run. It also conducted by randomized, which the people taking part is put into treatment. The randomization is done by the computer and certain details are considered like age and gender. The randomization is done to ensure that the last phase in the clinical trial is phase 4. This phase is conducted after the drug has been granted license from DCA. The objective of this phase is to find out about the drug side effects, safety.
Assalamualaikum, Grandma. Ada cesal medicine.
Waalaikumsalam. Huh? What? Medicine? I don't want to eat those medicine because my friend said that modern medicine have a lot of side effects. Look at this.
Actually, Grandma, all the medicine have their side effects, such as
Generally, all sulfonylurea drug can cause hypoglycemia, but each generation have different side effects. For first generation, the common side effects are headache, dizziness, paresthesia, abnormal discomfort, and nausea. Propopamide has longer duration of action that leads to hypoglycemia, while acetoacetamide was withdrawn from use and no longer available. It also can cause abnormal liver function. Next, for second generation, common side effects are weight gain, and the rest is same with first generation. Glibenclamide can cause hypoglycemia in 20% to 30% patients. These drugs are 100 times more potent with short half-life. It can be administered in lower doses and can be given once daily. It can increase risk of cardiovascular disease and contributes to low risk of hypoglycemia in chronic kidney patients. It must be avoided by a patient with severe renal impairment. Lastly, for third generation, it can cause mild reduction in insulin resistance. It gives low risk of hypoglycemia, which is only in 2% to 4% patients. It is safer for people with advanced kidney disease, and it do not block normal relaxation of blood vessels and do not affect coronary arteries. From this table, drug potency increased across generation. The improvement on drug formulation can be seen as the dose range and dose per day is lower, but the effect still same.
But don't worry, the doctors and pharmacists know about it and manage to encounter with it.
Oh, I see. But can I just eat natural product?
You can consume the natural products, but you must also take the modern medicine because they are much more potent and has been certified. The example of the natural products such as
There are three natural products, which are bitter melon fruit, fenugreek, and aloe vera. Firstly, bitter melon fruit. It has carotene, insulin-like peptides. Its structure is similar to insulin as found in the animals to have glucose-lowering effects. It is suggested to consume 50 to 100 milliliters of fruit juice daily.
secondly, fenugreek. It contains fiber that slows the digestion process and thus regulates the absorption of glucose. It has 4-hydroxyisoleucine, an active compound that has an insulin-like effect. 1 teaspoon of fenugreek powder is suggested to be consumed.
Finally, aloe vera. It contains glucomannan, a water-soluble fiber that has hypoglycemic and insulin-sensitizing actions. It also has amidin, an active ingredient in aloe vera, and has hypoglycemic properties. It is suggested to consume 2 tablespoons of the gel.
Alright, babies, I will take this medicine. Thank you for taking care of me.
You're welcome, Grandma.
There are a number of issues when diabetic patients take sulfonylurea drug. First and foremost, patients have a greater prevalence of hypoglycemia. Sulfonylureas act directly on beta cells. As a result, they cause progressive dysfunction and worsening of insulin secretion. Secondly, weight gain occurs to diabetic patients. As mentioned before, the inhibition of insulin makes the lipolysis process do not occur and fats will be further accumulated in body. Thirdly, cardiovascular disease is also linked with the problems of sulfonylurea drugs. This happens due to the interaction of sulfonylurea with cardiomyocyte. There are sulfonylurea receptors on cardiac myocyte and vascular smooth muscle. The presence at the time of a myocardial infarction may impair adequate coronary vasodilation. Thus, it results in a larger areas of myocardial damage. Other issues that may occur with sulfonylurea drugs include nausea, liver failure, and skin reactions such as erythema multiforme, exfoliative dermatitis, and photosensitivity.
Previously, we can see that sulfonylurea drugs could cause weight gain, hypoglycemia, cardiovascular diseases, and many more. In order to overcome these issues, the physicians and pharmacists must take precautionary measures during their clinical practice towards the diabetic patients. Firstly, patient selection is important in determining who is suitable or not suitable for this drug class. For example, sulfonylurea drug acts by stimulating beta cells to release insulin, so it is unlikely for patients with low number of beta cell counts to respond to these medications. Sulfonylurea should be preferred as initial therapy in patients with previously diagnosed functional beta cells mass, contraindication to metformin, and suspected MODY. Patients with hepatic and renal impairment, elderly, and people with poor nutrition are advised not to undergo sulfonylurea therapy. Secondly, is drug selection. Clinical factors such as stages of fasting, postprandial hypoglycemia, and hepatic or renal dysfunction decide the selection of one sulfonylurea over the other. Finally, patient empowerment and physician empowerment is equally essential in managing sulfonylurea issues. Patients should be educated on signs and symptoms of hypoglycemia, self-down titration of dose, the importance of regular exercise, and healthy lifestyle. Self-monitoring of blood glucose is a tool that aids in improving glycemic control.
And I know when I need it, I can count.